Hi, this is Dr. Wells with Wells Medicine. And a question I get a lot is, will ketamine cure me? One important thing to focus on is that for any mental health issue, that tends to be a recurring condition. So, just like insulin doesn't cure diabetes and beta blockers don't cure heart disease, ketamine isn't a cure for depression or anxiety either. Just like with insulin for diabetes or a stent for heart disease, it's a maintenance therapy that helps alleviate the symptoms and can decrease the effects of the illness on your life. We try as much as possible to create a holistic treatment therapy that has the best promise of alleviating the symptoms and decreasing the effect of depression or anxiety on a patient's life. And so, what I mean by that is, with depression, there's a lot of isolation. So we encourage a lot of socialization and a lot of getting out and seeking out the company of others and relationships. With depression, there can be a lot of anhedonia or decreased desire to do things, decreased pleasure in things. So we encourage patients to seek out pleasurable things and to stay in the moment. With depression, there can be a lot of um, problems with insomnia. And so we work very hard to work with our patients on sleep techniques and insomnia techniques. And those aren't a cure for insomnia either, but rather exercises and techniques to help treat the condition. Ketamine, through its mechanism of action, blocks the NMDA receptor, which inside the cells of the nervous system in the brain increases glutamate and increases brain-derived neurotrophic growth factor, which increase neural synapses and can decrease the fight or flight and rumination pathways and lead people to have increased resilience and increased mental flexibility. And that can really help alleviate some of the stuckness that a lot of patients with anxiety and depression feel. But I think as life progresses, things happen. And so often, even when patients can spread out the ketamine treatments by months and sometimes even years, we might often see patients back when their dog dies or they lose their job. And when I first started treating patients in 2015, we had a lot of patients that I didn't see back until the 2020 coronavirus pandemic, when the world kind of shut down again. So sometimes we'll see patients back for a few visits, and then they'll be off again doing all the great lifestyle changes again.